jump into some presentations from some of our day service providers on their current status and what they offer for their programs. So I'm going to share my screen currently, and so folks can just follow along and ask any questions in the chat as we go along. Okay, I think everyone can see my screen. So as of last week, so far in the month of May, there have only been one new COVID positive amongst the people that we support. There have been none in the last week since we've had our last call last Friday, and that one person was on May 12th, and they were in a host home setting. I'm sorry, just going back here. So the total number as of today of people who have been infected with COVID stands at 429. Again, there was one person who tested positive twice, and we have been going back and forth on that, but they were definitely diagnosed twice with COVID-19, so that brings our number to 429. So far, COVID infections by placement, the majority of the infections have been in supported living settings, along with natural home, and there have been several infections within our congregate settings, as seen here. Mostly on the congregate settings, intermediate ICFs have had 114 infections. Our residential habilitation has had 37 infections since the beginning of the pandemic. And then nursing homes have had 2 infections, and there's been 1 infection in a mental health facility. There have also been 4 people with out-of-state placements who have also tested positive. Basically, this next chart here breaks down the COVID infection rates and death by placement types. People with COVID-19 have been more prevalent in ICF facilities, as well as the death rate. The people with COVID-19 diagnosis have been more prevalent in ICF facilities, and death rate has been higher among those and within those facilities as well, based on the total population as segregated by those settings. And this is additional features, additional chart showing the diagnosis breakdown and frequency by placement type over the last few months since the beginning of the pandemic in March all the way through May, as you can see there, the chart above. We have leveled out since April, and we have pretty much leveled out in May. As you can see, with numbers here show 0 infections for May. The 1 infection, as I mentioned before, was in a host home, so it did not fall into any of the categories listed above. These are the breakdown of people who have required inpatient hospitalization because of the diagnosis of COVID. We had 1 back in April, but so far in May, no one has needed hospitalization-related treatments because of the COVID-19 pandemic, or I'm sorry, because of a COVID-19 diagnosis. So far, we have lost 56 people that we support to COVID-19. In the month of May, 1 person in a host home has passed away from COVID-19. However, in April, we have not had any deaths from COVID-19. As you can see, a definite reduction and a slight increase of just 1 person who has passed from COVID-19. Again, the total since the pandemic began was a total of 56 people. There have also been 36 people who have been diagnosed with COVID-19, who we have confirmed to have died from COVID. So this means, there are still a few folks who are being examined to determine if they actually died from COVID-19 by the Office of the Chief Medical Examiner and other related bodies. So far we have been able to confirm 36 people supported have actually passed away from COVID-19. There have been no confirmations of COVID-19 deaths in April or May, and we are still awaiting, I think, around 20 plus confirmations from different medical examiner offices. Provider staff diagnosed with COVID-19. So far, there have been 696 provider staff that had tested positive for COVID-19. 51 of those people have worked in more than one setting or more than one provider type. and unfortunately, we have lost 10 staff from COVID-19. So far this week, there have been 2 new positive cases of COVID-19 amongst the people that amongst the staff that support the people that we support. And I think that's the end of this presentation. Any questions? I'd be happy to take any questions and answer any questions. Okay, so I'm about to share my screen again. I'm just going to go through the list of people who I'm sorry, of providers that will share their status as day providers and what services they offer and where they are in bringing services online, or if their services are currently online, they can definitely give us a little more information. I'm going to share the list. I'm going to ask that the providers listed please put into the chat box the person who will be presenting so that we can make sure to transition quickly. And so I can unmute you quickly. So we're going to start first with, give me 1 second. Let me just share my screen here.
While you're doing that, Kirk, if we could have Donald Clark present prior to the providers.
Absolutely, that's perfectly fine. Donald, do you want to present currently?
Sure. Just more of an announcement. Good afternoon, everyone. Similar to the announcement I made yesterday at the Provider Coalition to DDS providers, I just wanted to make sure that all the providers that have applied to participate in SHIFT's educational enabling technology educational program have in fact received the notification email from DDS techfirst@dc.gov. It's a very important email pertaining to program details as well as next steps. Just so you're aware, orientation is on Monday, May 24th. You have 1 of 2 slots to pick from as far as time slots to participate in orientation. The first slot is 10 to 11 a.m. The second slot is the same day on the 24th, 3 to 4 p.m. Really excited to get this kicked off. Again, thank you for the wealth of responses to SHIFT. Actually, more than we anticipated getting as far as responses. And we're very happy and proud to be able to offer this to all the providers who have, in fact, applied to participate in this program. So, again, please check your emails. If you do not see that from DDS Tech First at dc.gov, feel free to reach out to me. I'll drop my email address in the chat so we can make sure you get the information. And I look forward to seeing you all Monday for orientation. Just another FYI, this program will officially kick off after orientation, June the 7th, and will end September 30th, 2021. So again, thank you. Look forward to Monday. Everyone have a great weekend.
Thank you, Donald, for the updates, and thank you, Crystal, for also facilitating that. So we're gonna get started. I'm waiting to hear back from our first provider, Bridgeway Community Services. So in the meantime, I'm going to turn over to Theodore Nagachu with Galaxy Healthcare to briefly introduce this organization, and in about 2 to 3 minutes, just summarize their opening status and what they are offering. Theodore?
Yeah.
We can hear you.
Okay, thank you. So,
Theodore, are you with us?
yeah. I'm going to have Sabrina to do the presentation.
Sabrina Mims? Mr. Nagachu?
Yeah, that's Sabrina is going to be the presenter for Galaxy.
What's her last name?
Sabrina Mims.
Sabrina, you are on mute.
Yes. Good afternoon. Yes, I'm Sabrina Mims. I work with Galaxy Healthcare.
We can hear you. Miss Mims, I think Miss Mims is having technical difficulties. Unfortunately, she was dropped off our presenter list. So while they sort through their technical difficulties, I'm going to go to Global Resources and Supports, and they're going to show us a video. First, I'm going to turn it over to Destiny, who will give a brief introduction of the video. Okay, let me share this video. So I'm going to share my screen and share that video. And again, this is Global Resources and Supports.
Global resources and support, empowering all people to live quality, self-directed lives.
Thank you to Global Resources for sharing that. I will share the link to this video after the meeting. I understand that some folks had some technical difficulty seeing it, so we will definitely get that shared. I'm going to go back to our next presenter by sharing the screen once again. Next up on the list is Health and Joy. I believe Health and Joy would like to share a PowerPoint, so I'm going to make sure to get that done for them. Alaji, you're now unmuted. I'm also making you a panelist so you can share your presentation.
Thank you.
You should be able to share it right now.
Okay. All right. Hello, everybody. Health and Joy Services and our IDS program has been open since January of this year, 2021. And just like everybody else, we were asked to submit a safety plan by DDS to ensure that we have a health and wellness safety plan for COVID-19 to be able to support the people that we serve in a safe and healthy environment. So for us, all of our staff have a backpack filled with PPEs that they carry with them. And that backpack has, they have mask, they have shield, they have sanitizer, thermometer to check the temperature of the people that they work with. And each day when they meet with them in the community, sometimes outside of their home, in their lobbies, our whole goal is just to engage our people to be able to resume the services and the things that they like. And these are pictures of different activities so far that we've been doing with our peoples this year. It's individualized based on the person's interest. We travel train them to be able to get to different locations. We make sure we pair our staff with the person that they support based on their interest. And that's identified from the interview process and through the orientation process, and just making sure that we, the staff that we hired to work with a particular person have similar interest. For example, we had a staff member who enjoys sewing. So each week when she takes somebody to the person who goes to weekly sewing, it's something that they both can participate in. It doesn't feel like, work. And we also have an ASL staff that supports somebody who's deaf. So for us, we want to emphasize on the language of that's one of our niche, to make sure that we meet in the person's language, whether it's bilingual person with a Spanish speaking staff or ASL staff that speak the person's language when it comes to deaf. So for us, this is what we do right now, Monday through Friday, 9 to 3. And if any provider have any person that's interested in providing an individualized day support services, Health and Joy is currently open, and we are willing to serve our people to meet and enhance their days. Thank you. Thank you.
Thank you so much for presenting. We're going to go on to Gloria from HealthTech. Gloria, you should be able to unmute yourself.
Hi, thank you. Can you hear me?
We can.
Okay. Yes. In a nutshell, HealthTech provides supported employment readiness, rehabilitation, small group rehabilitation, individualized support, companion services, and in-home support. HealthTech has received 5 admissions or returns since approval of reopening plan on September 21. We continue to support 5 persons in supported employment and companion services. We aim at working together with provider community in a way that is safe and sustainable. We maintain protocols based on science and with accordance to DC health guidance, assessing and adapting these based on our unique community-based setting. These trainings and protocols are updated, but DC Health and CDC guidelines changes as the COVID pandemic evolves to ensure safety, health, and well-being of all. How COVID-19 pandemic has reshaped health tech. March 2020 was a nightmare. Pandemic hit us hard. Such was not expected, and we were unprepared. Day program services were shut down with no guidance and no direction as to what next. Fear of the unknown among management and staff was overwhelming. Some staff quit their positions, some stayed on. Soon, reimbursing staff became unsustainable for health tech. With government support down the road, health tech stood up and began to strategize on how to survive and continue meeting DDS and waiver requirements. The following paid off during these times until now. Staff cross-training, health tech's policy to train staff across board on all persons saved, helped for emergency backup support. Upper management training and relationship with persons. Upper management serve as backup staff in staffing emergency situations. There were days where all management staff were DSPs. Relationship with other service providers offered a sense of comfort that our struggle is not isolated. We also exchanged ideas and strategies to keep afloat. Quality resource specialist. This was not, this time could have not been easy if it was not for our quality resource specialist. His guidance and support help us tremendously. Takeaway from the pandemic. In the midst of all of it, there was so much growth in the day support. We learned in the process, and we have embraced lessons learned and plan to maintain them as we are moving forward. Some of the things we plan to embrace is, first of all, the realization how the persons we support are a family to us. When we were abruptly separated, the impact was felt across board. Staff members cried, persons cried. There was a lot of interventions and de-escalation that needed to happen. Staff were on calls and Zoom with persons explaining to them why they can no longer attend, and to comfort them, to assure them that they will return as soon as the pandemic is behind us. Mitigation protocols such as the temperature checks prior to sending persons off transportation are meaningful. We plan to encourage this to continue when a person from home states they're not feeling well or when they're not looking well. This protocol will be best to keep. Hand washing intermittently between activities. Traffic reduction protocols during drop-off and pickup are working. Zoom meetings and trainings are working. Zoom interviews are working. DSP emergency light backpacks. The light backpacks, that we have prepared for all our DSPs with essentials like gloves, hand sanitizers, thermometers, Clorox wipes, first aid kits, medical masks, and other things. We intend to maintain those, excluding COVID-specific items. CPAC meetings, we have realized that when effectively used, they place persons in a desired and most suitable setting. We plan to continue on question and answer sessions on vaccinations as most people continue to be hesitant to take them, citing different or various reasons, such as bearing children or producing sperms and so forth. Moving forward, we envision that services and supports will remain different moving forward due to many system changes during the pandemic. Best practices learned during pandemic have changed most aspects of our lives and the way we think and operate. HealthTech will use the format of CPAC in pairing people, one person with another, pairing persons with DSPs, in recommending services, in setting group ratios, and setting schedule of activities, while paying attention to safety, health and age group, among others. That is some of the things that HealthTech is currently doing with our day program services. Thank you for listening.
Thank you so much for presenting. Next, we're going to go on to NCC. Ishmael, you should be able to unmute yourself.
Yes, okay. Can everybody hear me?
Yes, we can hear you. Thank you.
Okay, great. All right, how you guys doing? My name is Ishmael Jambai. I'm the Assistant Director of NCC's Community Day Support. And we want to let you guys know that, yes, we are open. Currently, we're providing day habilitation. We're providing that in facility and community-based. We're also providing companion services in the home and also in the community, and we are currently providing employment readiness. As we opened up on April 6th, we still remain to follow our safety rules and regulations. We're teaching our person supported from the foundation how to wear a mask and remove it appropriately, social distancing and washing hands practices. We're also just making sure that our person supported are now reestablishing themselves back into the community. So we're more so doing exploration in the community as our person supported are going back to their old community activities prior to the pandemic, that they are reestablishing themselves. And one new thing that our day program has also implemented is VR system. For those that don't know virtual reality, it's able to wear a type of device over your eyes where you're able to immerse yourselves in different and newer things. So some of our person supported here at the day program were able to swim in the water. They were able to feel as if they were close to a white whale, that we were able to open these things just through Companion. And also we have partnerships with another company that provides us with VR devices that they're able to practice certain things at the day program and then also apply it in the community, such as police encounters, that they're able to look through a VR device and go through many different outcomes and talk with police officers in any type of situations, that if they're lost, if they're needing help, if someone is hurt, that they're able to talk virtually through a VR device and then apply those things in the community. So we've been doing really big things with our day program and our companion service, but we're also making sure that our person support are out in the community as much as they can be and remaining safe. One big thing that we've noticed here is that most of our people like to reintroduce themselves into fitness activities, that through the pandemic, a lot of us have gained weight, that we've been home, that we've been sitting out. So NCC's #1 priority is making sure that our person supported are reestablishing themselves in the community, that they are finding new activities, but they're also going back to their old activities prior to the pandemic. And just, again, like I said, reestablishing themselves. We're also providing services through virtually through Zoom, that we're doing a lot of Zoom classes, that anybody that has any interest in doing things virtually rather than coming to our program, we're still individualizing and making sure that we reach out and meet everybody's needs. But overall, currently NCC is currently open, meeting in person, meeting virtually. We're doing new things with technology. We're embracing technology, but we're also making sure our person supported are going out in the community and making sure that we're remaining safe and mitigating this virus. Thank you so much.
Thank you for sharing. Just a brief announcement. If anyone has any questions for DDS, DC Health, or for any of our providers, please go ahead and enter them into the chat box, making sure to click on the Everyone tab below the chat box. So if you have any questions for any of those entities, please go ahead and enter them at this time. Thank you again, NCC. We're going to now turn it over to Project Redirect. If Project Redirect is not able to join at this time, in that case, we're going to move on to PSI, Bill Howard.
Okay, can you hear me, Grace and Kirk?
Yes.
Excellent. All right, here we go. All right, my presentation is going to be, well, non-video and somewhat brief. I have to say that, okay, PSI day program is open, and we began providing service to people back in October 2020. We were at a very small group. We're still at a very small population, but we started off slowly, and we're currently able to scale up as conditions permit. So as we're able to maintain proper spacing, proper staffing, all those sorts of things, and making sure that the people have meaningful activities. So during this, PSI is following all the guidelines from the CDC, DC Department of Health, and the DC Department on Disability Services. We have sufficient PPE, and we're observing social distancing and hand washing protocols. We have multiple hand sanitizing stations. We consistently disinfect and sanitize all surfaces and materials in our building. We also minimize group size to limit interactions. PSI staff and the people we serve have been fully vaccinated, but we still adhere to all the safety precautions. PSI is currently offering the following services: day habilitation, employment readiness, supported employment, and individualized day service. And that's Monday through Friday, basically 8:30 to 2:30. However, we do offer some services during the evening as well. We support currently multiple people on jobs at Joint Base Andrews and the Library of Congress. We engage people referred in meaningful community activities. We support people we serve in several volunteer activities at food banks around the city. As the city and community opens up, PSI is offering people opportunities that are consistent with their desires. We continue to monitor the status at community parks, recreation centers, museums, and other areas of interest people may want to visit. We're now receiving referrals from DDS service coordinators for service for people they support. Many people are coming back part-time to reacquaint themselves and their caregivers with the routine of being back in the community. And so some people start off part-time and that's what they want to do. Other people start off part-time and then they want to increase their level of activity and involvement. So we're very flexible, in that regard, in terms of meeting the needs of people we serve where they are. We have gotten referrals from both, well, obviously DDS service coordinators, but also some have been from residential providers through the DDS service coordinators, and some have been from natural homes. So we have a good mix of people that have come back looking for meaningful engagement and activities. And if there are any questions, I'll be happy to answer them at whatever time they present. That's it. Thank you.
Thank you so much for that presentation. We're going to go back to Project Redirect. Marsha Curry, you can unmute yourself whenever you're ready. I don't see, Marsha's in the list, but she has not unmuted. Marsha, are you able to unmute? Okay, I will try to come back. I guess there may be some technical difficulties there. So in this time, we're going to turn it over to St. John's Community Services.
Good morning. This is Kim Walker from St. John's Community Services. Happy Friday to everybody. I'm so excited that the juncture where we open up the programs. I'm excited to report that St. John's has been open since November of 2020. We are currently providing the following services: IDS. We have music therapy by Jody Albright, and she completes that either virtually or in the home or in the community. We have art options. We do have a studio. They have supportive employment. I'm excited to report that all of our folks work through COVID-19, and employment readiness. In addition to that, we have virtual classes that we're providing to some of the individuals that may want to come back one day in the community and one day they might want to stay home. Some of those classes may consist of cooking classes, Zumba with Dion, kickboxing, fitness, Wheel of Fortune, bingo, and art classes. As a matter of fact, they can even suggest any classes they want, and we would definitely create that a virtual opportunity for them. And we all also paired up with other virtual programs in the community as well. We continue to follow the COVID-19 guidelines. Happy to report that nobody in the day program has had COVID-19. So we are excited and we're looking forward to just having all of our folks come back and have brand new experiences in the community. Thank you very much, and everybody have a fantastic weekend.
Thank you so much for that. Marcia, are you able to join us now from Project Redirect? You're unmuted.
Can you hear me?
Yes, we can hear you now. Thank you.
Oh, wonderful. I'm so sorry. Good afternoon, everybody.
Marcia, we're not able to hear you any. Oh, you just disappeared. I think she's having technical difficulties. Sorry for that. So we'll go on to Total Care Services.
Good afternoon, everyone. Kim Dickerson Daniels, Director of Quality Assurance and Compliance for Total Care Services. I am also joined by our Program Manager for our Day Services entity, Jopalay, Mr. James Smith. Total Care Services is excited to come to you all today. We have been, and our plan to reopen was approved as of November 2020. Although we had not returned to our brick and mortar, we chose initially and will for the next 60 days choose to focus on companion. We anticipate full operation, meaning return to brick and mortar to include, but not limited to, day services inclusive of one-to-one, IDS, which will be solely community-based, employment readiness, which will be offered both in the brick and mortar as well as virtually, along with our supporting employment and RSA. We have been and are actively providing RSA services virtually at this time, but we look forward to bringing back any person interested in exploring that support or any of our supportive services to our brick and mortar setting. We continue to remain operational in Hyattsville, and we have been and will continue to comply with all recommendations from the CDC, Department of Health, DC Department of Disability Services, Disabilities Administration, as well as our own internal policies to mitigate and hopefully abate the COVID-19 vaccine. We are excited to share that the majority of our staff who are currently working have been vaccinated, as well as the persons that we provide supports to. We currently utilize, for those persons, especially those in the natural home who require transportation services, Uber, Lyft, where it's the person and the staff assigned to mitigate exposure to public transit, or let me correct that, mass transit, because Uber and Lyft is public transit, mass transit. We use that also as opportunities to continue to move our innovation processes forward, teaching people how to better and further navigate their smart devices for booking, ordering Uber and Lyft, for connecting to virtual opportunities in the community, and for continuing to develop partnerships with others. We are excited and willing to partner with other providers in trying to return the people we support to normalcy. Thank you so much for your time today. We can be reached, of course, at Kim DD, most of you all know my last name, at totalcare1.com, or James, that's JAMES, another S for Smith, just a straight S, at totalcare1.com. Thank you and have an awesome day, everyone.
Thank you so much. Just a quick announcement again, please, if you're sending chats into the chat box, please make sure that you've used the everyone setting in the drop-down box located within that larger chat box. Again, please make sure to send it to everyone so we can all see it. Thank you. Next up, we're going to turn over to UCP for your presentation.
Good afternoon, everybody. Happy Friday. We are near the end, so I'm going to try to make this as quick as possible. UCP will be reopening our doors June 7th, of this year. We will be doing small group, which consists of 1 staff per 3 participants. We're also offering companion and individualized day services. And for those that are out in the community, our staff will be equipped with appropriate safety supplies. Now, for those who are not ready to come back, we will still be offering our virtual services. where we do it twice a day, Monday through Thursday, and on Friday evenings, we will still be offering our fun happy hour. Now, in the building, we are going to have a pandemic era modified schedule, which means we will have 2 sessions per day, morning and afternoon. The morning session is from 9 a.m. to 12 p.m. Our afternoon session is 12:30 p.m. to 3:30 p.m. And as you notice, that is 3 hours per session. And it is up to the team, which definitely includes the person, to choose which session is best for them. Now, of course, everyone wants to know about safety. Again, no more than 5 groups per session, which equals to 15 participants at one given time. At this moment today, 90% of our staff are fully vaccinated. Woohoo! We will continue to practice precautions as if the vaccinations were not in existence, which means we're going to have social distancing, appropriate PPEs. We're maintaining an hourly cleaning, disinfecting schedule. Every area is equipped with protective barriers, such as the plexiglass shields for the desk, and that's between each person, hand sanitizers throughout the center, as well as at each workstation. Individualized materials, which mean nothing is shared and they are assigned per person, stored, maintained, sanitized, closed separately, so that there's no quote unquote cross-contamination. We do have a staff that's there specifically just for cleaning and sanitizing. So we don't have anyone multitasking. Our facility will be cleaned daily according to CDC, Department of Health guidelines. We're doing that before, after each session, hourly, and more frequently if we need to. We're going to still follow our reopening plans, which includes temperature checks upon entry and re-entry, because if you go outside to get lunch, you still have to go through it when you come back in. We're completing our questionnaires and proper sanitization. We're continuing all of this until COVID is a non-factor. Now, with all of that said, our staff are in place and we're excitedly ready to welcome the safe return of our person served. Thank you.
Thank you so much. I think we have time for one final presentation. So volunteers of, Vested Optimum. Are you with us?
Yes, I am. Can you hear me?
I can, thank you.
Okay, great. Good afternoon, everyone. My name is Glenn Wiley, and I am the program director of the program. Vested Optimum Community Services, better known as VLCS, is exciting.
I think, I'm sorry, we're having trouble hearing you consistently. I think there's something wrong with your speaker or your microphone.
Okay, can you hear me now?
Yes, thank you.
Okay. Vested Optimum Community Services, better known as VLCS, is excited to announce that we are open to provide various day program services. VLCS is transforming the way that we do business, not only due to COVID-19, but due to changing trends in providing services for persons with intellectual and developmental disabilities. Our focus will be providing more services in the community and ultimately eliminating facility-based services. However, during this period wherein the district is in phase 2, we continue to be flexible in providing virtual services for the person's choice and thereafter. Strongly encourage persons selecting our program and staff to be fully vaccinated to protect themselves while navigating in the community. The day program is currently undergoing an internal transformation and welcomes the opportunity to build more partnerships with community members and business owners on behalf of the people that we support. COVID-19 has challenged everyone to think outside of the box. This is a prime opportunity to build partnerships with business owners in the hospitality, tourism, and food service industries for persons seeking this type of employment. Businesses have been impacted by COVID and are trying to rebound by looking for a reliable workforce that is also dependable. DC relies heavily on revenue from these industries. Our trained staff are up to the challenge. Our team is open to assist with facilitating new experiences and opportunities for persons supported by minimizing the digital divide through use of increased technology. Technology is a real eye-opener and is necessary for people to feel an integral part of their communities and promote active engagement. VLCS is accepting referrals for IDS, rehabilitation, employment readiness, and supported employment. We look forward to meeting with interested persons and their teams. For further information, please contact me via email at belinda.wiley@vested.com. Thank you for listening and have a wonderful weekend.
Thank you so much. So we do have about 2 or 3 providers that would like to present. I know we are coming up onto 1 p.m. I know we also started late, so I'm okay continuing this until 1:10 p.m. to get those providers to speak. Before folks go, though, I just want to let everyone know that we are creating, DDS has created a booklet of all day providers that are in service and will be providing services. And this booklet will include special flyers that the providers have submitted. Each QRS has reached out to their day service providers to get information. And so we hope to get all that information in today and have that booklet out early next week to everyone in the community and to all providers. In addition, we will be providing a full list and contact information to providers, residential providers of all the day programs that are open and opening, so that they can schedule appropriate IDT meetings with their team to go forward and schedule, for the people that they support. So I just wanted to make sure everyone knows that and that we can move forward. At this time, I'm going to turn over to Innovative Day, who has joined us. Louise, you can go ahead and speak.
Thank you for the opportunity, Director Kirk. My name is Louise Asimov. I'm the Program Director for Innovative Day. Innovative Day has been successfully opened since January, and we have had so many activities going on. It was a challenge at first. One of the things that we did was send out surveys for our participants to fill out and let us know how they feel about returning, the days that they'll be returning, so we can have a schedule set for them to ensure that we maintain the capacity in our reopening plan. And when our reopening plan was accepted, we had reorganized the building, removed chairs from where they were, and everything was approved. So that made people, comfortable to come back. We also have separate activity kits for each person. We do not share them. We have sanitizing stations at each door. We have capacity on each door on how many people should be in a room at a certain time, which means that when we're going around to see who is in there, we have to see 5 people in a room. It has to be 5. We also have successfully had activities for those that returned, like we did Cinco de Mayo, we did lunch at the park, we did Easter celebrations. So those were successful both in the building and outside the building. We had a lot of senior citizens that we used to support and who wanted to return, but the recreation centers were closed. So we created a spot for them at the day program to make them feel safe. We had about 3 of them returned already. We also have individualized schedules for everybody that was returning, and made sure that we supported our natural home parents by having them come to our vaccine clinic. So we did provide transportation and staffing to try and get them to come get the vaccination. As of now, more than 92% of the day program staff have been vaccinated. 100% of every staff that has returned has been vaccinated. We also did monthly COVID testing to ensure that people are safe, and it is still ongoing. Both staff and persons, they do a monthly COVID testing. This was done through a contract and a protocol that was sent out for everybody returning to adhere to. So that also worked. We also have our RSA program. That is one of the expansion that we've had. We've had an 80% increase on referrals because due to interviews, job fairs, and people getting, just interviews that they're getting and having a job. We've had 3 people had jobs. So I think our RSA coordinator sees that, and we've been having those referrals, which is a good thing. We just had 5 referrals, awesome for us. We continue to stay safe. We continue to provide safe environment for our people. We continue to have our activities. Our IDS folks are out in the community, and we ensure that the staff are fully trained. And another thing that we did is that we train our participants before they start coming to the day program. So it's like a whole day where you do your trainings on what's going to be happening, because everything has changed, as we all know. So we have, in a nutshell, kept our supported employment program. We had two people had COVID, but the day program since January, nobody had any COVID. And we have 25 people that have returned to the day program, successfully coming in scheduled days. So to maintain capacity, that's what we have been doing. Thank you for the opportunity.
Yep.
And we are open to all day program services, employment readiness, IDS. They have one-to-one RSA, supported employment, and RSA and job search. So we open for all of that.
Thank you so much. Just one final presentation. Marcia, I think you were able to join us now from Project Redirect.
I'm here. Good afternoon, everybody. Okay, I think one of the issues, I had two phone calls. I apologize. Good afternoon. It is so good to see everyone, and I truly appreciate this opportunity. A few services in spite of the pandemic. I do want to first thank DDS. These weekly meetings have really sustained us, motivated us to keep going as day program providers in the midst of all of this. I am very excited to say that we do have 2 locations currently operating. Our Chillum Place in Northwest DC is operating, and our Silver Spring location is still operating. The current services that we're providing right now are day hab, IDS, employment readiness, and supported employment. And all of these services are being provided a little differently. So in terms of virtual services, and we heard a couple of people talk about different ways we're doing virtual. In terms of virtual, we're doing actual Zoom calls. In terms of how we're operating our supported employment, it's also through Zoom. We're using FaceTime. We're using, I think it's called Duno. That's another technique that we're using in terms of communicating with people. In terms of the virtual services, what we're doing right now is when we do a virtual employment readiness, we create packages which is involved with the people we support. And so they decide, what are we going to talk about this week or next week? And then we get the packages together and we actually deliver it to the people. So that's the way that we've been actually able to stay in contact with people. We've done some drive-bys where we actually visit people. And this has nothing to do with funding, just to say hi to them. We've coordinated with some residential providers that's on the phone with just how do we stay connected. And before we actually sent out these cards, this is right when COVID hit, this was our way of just communicating with everyone. We did a lot of calls, and we're still doing that. So with ER, we're doing that virtually. Supported employment, in terms of job coaching, we have a couple of people that are long-term workers, meaning they've been working, they've been doing a good job, but they still need that support. But the employer weren't letting us go into the building because of COVID. So we were able with DDS and their team to develop plans where we could still provide that job coaching in a face-to-face, but that person would actually not see us physically, but would see us in person, but we could still be the liaison between them and their employer. So that's worked. In addition to that, we know everything has changed. So one of the things that we're doing, no matter what, we are wearing masks and we have our face shield. So even when I came on, I had to decide to take it off because if we're in a room by ourselves, we can do that. And what we're doing is really practicing with our participants who are returning. How do you learn to social distance? So one of the things that we're doing in this thing is where we actually hold our arms away from each other, and we're teaching our people who may not be able to understand, but they know that if we're not touching hands, then we're doing the right thing and we're staying far away. So in terms of our robust COVID screening protocol, and I think it's very robust, when people come into the building, and if they don't come in and we have to meet them at the door, we're there with our temperature gauge. We're taking their temperature. We're doing our COVID screening. How are they feeling? Do they have any signs or symptoms? We're documenting that. We're speaking with the house or the home before the person actually is given to us to make sure there was no problems before they came to the day program. In terms of drivers, the drivers used to come in and sign the books. They no longer do that. We take their temperature. They know to stay at like the doorway, and we take the temperature. We document. We actually ask them about their signs and symptoms, and we document that. Hand wash and sanitizer. I mean, everywhere throughout our building, we have sanitizers literally everywhere. They're now even in the bathroom. So if it's beside the sink, we still have hand sanitizer as an option. In addition to that, we're doing a constant training. CDC is changing every day. DDS policies and procedures may change. And so we have to adjust with that. But what we're trying to do is make sure we're educating the people. So we're using different forms of videos. We're doing some graphic videos to talk about. One of the things that DC Health did a lot of videos with more graphics, which kind of is more interesting to the people we support. So we're doing different things to teach about that. Wow.
I'm sorry.
I gotta go. I'm sorry.
Yeah, I'm sorry. That's time. Thank you so much. I will, as I said, I will be providing that opportunity to advertise in the booklet.
Okay.
And so I hope that you really just include all that information. Again, to everyone who's on the call, thank you for joining, and sorry for our late start. We will be sending out that booklet shortly, and that list of all open day providers. Any day provider who has not had the opportunity to talk today, I see that Circle of Care and RCM were not able to discuss today. Please go ahead and reach out to your QRS, your quality resource specialist, to send in information and create you're able to create like a bit of a flyer for us to include in this booklet. So please reach out to your QRS immediately so we can get that out as soon as possible. Again, thank you everyone for joining today. If you have any additional questions, my email address is kirk.d as in dog, ob as in boy, son @dc.gov. And I'll put it in the chat and leave it open for a second so anyone could send me any questions they may have. Thank you everyone for your time, and I hope you all stay safe and have a great day.